The fuss kicked off here in the United Kingdom on Sunday, with the government due to announce its next phase of measures in the coronavirus crisis. Our slogan changed. It was no longer stay at home, control the virus, save lives. It was stay alert, control the virus, save lives. And the border of that logo had changed, perhaps subtly, from red to green. So, what's the big deal about two words, stay alert and a change of color? Well, it's because those two words held a lot of confusion. What did stay alert mean? Did it mean that we could now freely go see other people, our relatives, our friends, if we were alert? Could we go back to work in offices rather than telework, or have no job at all if we were alert? Could we exercise without restrictions? Could there be mass gatherings again as long as everyone in that crowd was very alert? And it only got worse over the next important 36 hours. On Sunday night, the Prime Minister Boris Johnson tried to put on the appearance of grave concern and responsibility in an address to the nation. On the one hand, talking quite rightly about the fact that any significant easing of stay at home, not stay alert, stay at home measures and social distancing risked a second deadly wave of the virus. But on the other hand, trying to cheerlead and hold open ideas that maybe with the unlimited exercise, maybe with some people going back to work in certain sectors, it was all showing that we were on the downward slope of a virus that has officially now killed more than 40,000 people in this country, the second highest rate in the world. And according to public health specialists, the death rate is probably closer to 60 or even 70,000. A downward slope towards the end. Well, if it was a downward slope, on Monday it was a downward slope to more confusion and not a clear vision of lifting this virus. By the time the government released its guidelines in the afternoon, it was in a complete muddle. Some ministers had said that you could meet one other person, a friend, in a park, as long as you kept your 2-meter distance. But then the Foreign Secretary, Dominic Raab, said, well, you could even meet your parents, who you haven't been able to see for weeks. Y'all can get together in the park. Only to be knocked back by a government which said explicitly, no, we didn't say you could meet one person, even if it was your parents. Perhaps even more significantly, the government had said everyone would go back to work on Monday if they couldn't work from home, but then said, oh, wait, maybe we'll do it on Wednesday. Why? Because there were no guidelines on providing safe workspaces. There were no guidelines which had been provided on social distancing, on reducing transmission of the virus. In other words, a COVID-19 secure environment. And as I speak to you on Tuesday, we still don't have those guidelines, even as the government says, well, tomorrow, y'all might be able to go back to work. There was no consultation with other parts of the United Kingdom. Boris Johnson was really only speaking about England. Scotland, not consulted. Wales, not consulted. Northern Ireland, not consulted. Indeed, Scotland and Wales last Friday, in a marked contrast to the confusion, had been very clear on issuing guidance for their next phases of what will continue to be a stay-at-home policy, and explicitly made it clear over the weekend, we're not changing our slogan to the vague and imprecise stay alert. What's the significance of this muddle that we are still in, as we are not sure, in fact, where we go through May and through June, beyond a government's sometimes vague aspirations, which is some people can go to work in some sectors, you can exercise without limits in some places. In June, some primary school children can go back, and possibly in July, maybe restaurants and other hospitality spaces can open up. Well, the fuss is because this isn't a slip. This confusion, this muddle, is the sign of a government which is concerned more about appearance than it is about transparency and even arguably effective planning. So, for example, it is true, and it should be noted that the rate of increase in deaths in the UK is falling. We are now talking probably around about 300 to 400 deaths per day, according to official statistics, whereas we were double that a few weeks ago. But at the same time, given the deaths that are occurring in the care homes, given the additional deaths that we are now only learning about in previous weeks, that official death toll is more than 40,000. Highest in Europe, second in the world. Yes, we can talk about the fact that hospitalizations are decreasing, but at the same time, we still don't have sufficient personal protective equipment for frontline National Health Service staff, for people who are carers who have died. Scores of them have died because of maintaining care while even not having that protection. Yes, we can talk about the fact that maybe we can envisage releasing or easing restrictions, but we still don't have a comprehensive, reliable testing system, which is a prerequisite for any lifting of restrictions because you need to contain the virus. The government simply is concerned to put out the message, stay alert, and the impression that that will make sure that all's okay, when not acknowledging, not being honest with us about what has occurred. Why haven't they been honest? Let's be point blank here. The government's messaging, in part, is to cover up past mistakes. It doesn't want to acknowledge that between January and mid-March, it did almost nothing in terms of the essential preparations to contain this virus. It did not provide for personal protective equipment. It did not bring in testing. It did not bring in tracking. It did not bring in surveillance. Why? Because it was pursuing a herd immunity strategy. In other words, let the virus spread. We can't contain it. Let's just let it spread. Enough of us get immunity that will be secure from it if there's a second wave. But of course, in the meantime, letting the virus spread meant that thousands, tens of thousands of people were exposed, and many of them died. The government will not acknowledge that when it pursued herd immunity, it not only was contrary to what it says, following the scientific advice, it in fact was overruling the scientific advice of its SAGE committee. That between January and March, it was not only allowing, it was endorsing mass gatherings, including at the Cheltenham Horse Racing Festival. That the Prime Minister, who could not be bothered to attend emergency meetings between January and early March, was actually advocating on film, shaking hands. The government cannot acknowledge those mistakes. Instead, what it has done through March, April, and May is put up slogans. We'll reach 100,000 tests per day, which they did by artificially manipulating the figures and changing the definitions of what it meant to have a test. The government has declared even today that deaths in care homes have halved, without acknowledging the fact that in the last hour, the additional increase over past weeks, recognizing the deaths that have occurred in care homes, deaths that they did not recognize for those weeks, means that more than 10,000 people have died in those facilities. And that's a conservative number. The government doesn't want to acknowledge the past, and so it cannot be absolutely clear about the present because it's not sure about the future. It's not sure about the future because even now, the government is not sure how far the virus has spread in the United Kingdom because of the lack of testing, because of the lack of tracking, the lack of tracing. Even now, the government is not sure about what it's going to happen in the future because it does not have an organized plan to be able to give us a reliable system to follow this virus. So what do? You message. But messaging isn't governing. Cheerleading is not informing. And trying to protect yourself from the past, trying to cover up the uncertainty of the present, all to leave us in limbo for the future, is not responsible. This government should be acknowledged for one decision that it made. On March the 23rd, belatedly, it dropped herd immunity and it brought in stay-at-home measures and social distancing. Without that belated intervention, this death rate could have surged even far, in fact, would have surged far higher than 40,000. Estimated it could have gone up to 500,000, according to scientific models. So yes, the government did that. But now in May, what are you doing clearly and transparently? What are you doing in terms of consulting other parts of the United Kingdom? What are you doing to make sure that your public can say, we are informed and we trust you in this next phase? I'm Scott Lucas of the University of Birmingham. Thank you for listening. Stay safe.